One such drug that has garnered significant attention in recent years is Topiramate. In this comprehensive video, we will delve into the intricacies of this medication, exploring its common uses, benefits, side effects, dosage recommendations, and associated precautions. Topiramate, a sulfamate-substituted monosaccharide derivative, has emerged as a versatile therapeutic option for various neurological and psychiatric conditions. Initially approved for the treatment of epilepsy, its applications have since expanded to encompass migraine prophylaxis and, more recently, weight management. Throughout this video, we will examine the multifaceted nature of Topiramate, shedding light on its diverse applications and the considerations that accompany its use. Common uses of Topiramate. Topiramate's primary indications revolve around the management of seizure disorders and the prevention of migraine headaches. Let us explore these applications in greater detail. Epilepsy. Topiramate is widely prescribed as an adjunctive therapy for the treatment of partial-onset seizures, primary generalized tonic-clonic seizures, and seizures associated with Lennox-Gastaut syndrome in adults and children aged 2 years and older. Migraine prophylaxis. Topiramate has proven effective in reducing the frequency and severity of migraine attacks, making it a valuable preventive option for individuals suffering from chronic migraines. Binge eating disorder. In recent years, Topiramate has been approved for the treatment of binge eating disorder, a condition characterized by recurrent episodes of compulsive overeating. While these are the primary approved indications, Topiramate has also been explored for off-label uses, such as weight management, bipolar disorder, and neuropathic pain. However, it is crucial to consult with a healthcare professional before considering Topiramate for any unapproved conditions. Advantages and benefits of using Topiramate. Topiramate offers several advantages that contribute to its widespread use and acceptance in the medical community. Broad-spectrum efficacy. Topiramate's ability to target multiple neurological and psychiatric conditions makes it a versatile therapeutic option, potentially reducing the need for multiple medications. Weight loss potential. In addition to its primary indications, Topiramate has demonstrated the capacity to promote modest weight loss, making it a valuable adjunct in weight management strategies. Favorable pharmacokinetic profile. Topiramate exhibits linear pharmacokinetics, meaning its blood levels increase proportionally with the administered dose, facilitating predictable dosing and monitoring. Unique mechanism of action. Topiramate exerts its effects through multiple mechanisms, including modulation of voltage-gated sodium channels, inhibition of carbonic anhydrase, and enhancement of GABA-mediated neurotransmission, contributing to its diverse therapeutic applications. Potential side effects of Topiramate. While Topiramate offers numerous benefits, it is essential to be aware of its potential side effects, which can vary in severity and frequency among individuals. Cognitive and neuropsychiatric effects. Topiramate has been associated with cognitive impairment, memory difficulties, concentration problems, and mood disturbances, such as depression and anxiety. Paresthesia. A common side effect of Topiramate is the development of tingling or numbness sensations, particularly in the extremities. Renal calculi, kidney stones. Long-term use of Topiramate has been linked to an increased risk of developing kidney stones, necessitating adequate hydration and monitoring. Visual disturbances. Some patients may experience visual changes, such as blurred vision, double vision, or acute myopia, nearsightedness. Metabolic acidosis. Topiramate can cause a decrease in serum bicarbonate levels, leading to metabolic acidosis, which may require monitoring and treatment. Fatigue and somnolence. Topiramate has been known to cause drowsiness and fatigue, which can impact daily activities and quality of life. It is crucial to discuss these potential side effects with your healthcare provider and report any concerning symptoms promptly. Recommended dosage of Topiramate. The appropriate dosage of Topiramate varies depending on the condition being treated and individual patient factors, such as age, weight, and concomitant medications. Here are some general dosage guidelines. Epilepsy. Adults. Initial dose of 25-50 mg per day, gradually increased at weekly intervals to a maximum of 400 mg per day. Children, 2–16 years. Initial dose of 0.51 mg per kilogram per day. gradually increased to a maximum of 9 mg per kilogram per day.
Migraine prophylaxis.
Adults. Initial dose of 25 mg per day, gradually increased at weekly intervals to a maximum of 100 mg per day.
Binge eating disorder.
Adults. Initial dose of 25 mg per day, gradually increased at weekly intervals to a maximum of 400 mg per day. It is crucial to follow the prescribed dosage regimen and consult your healthcare provider before making any adjustments. Precautions and hazards associated with topiramate. While topiramate can be an effective treatment option, there are several precautions and potential hazards to consider. Pregnancy and lactation. Topiramate has been associated with an increased risk of birth defects, particularly cleft lip and cleft palate. It is essential for women of childbearing age to discuss the risks and benefits with their healthcare provider and use effective contraception during treatment.
Metabolic acidosis.
As mentioned earlier, topiramate can cause metabolic acidosis, which may require monitoring and treatment, especially in patients with impaired renal function or concomitant conditions that predispose to acidosis. Hyperthermia and heat-related illness. Topiramate has been linked to an increased risk of hyperthermia, elevated body temperature, and heat-related illnesses, particularly during hot weather or strenuous physical activity.
Suicidal ideation and behavior.
As with many anti-epileptic drugs, topiramate has been associated with an increased risk of suicidal thoughts and behavior, necessitating close monitoring and prompt reporting of any concerning symptoms.
Withdrawal effects.
Abrupt discontinuation of topiramate can lead to withdrawal symptoms, such as seizures, anxiety, and insomnia. It is essential to follow your healthcare provider's instructions for gradual tapering of the medication. Topiramate compared to other medications. When considering topiramate as a treatment option, it is essential to understand how it compares to other medications used for similar indications. Anti-epileptic drugs. Topiramate is often used in combination with other anti-epileptic drugs, such as valproic acid, carbamazepine, or lamotrigine, for better seizure control. Its unique mechanism of action and favorable pharmacokinetic profile make it a valuable addition to combination therapy.
Migraine prophylaxis medications.
Topiramate is considered a first-line preventive treatment for migraines, alongside other options like beta blockers, tricyclic antidepressants, and calcitonin gene-related peptide (CGRP) antagonists. Its efficacy and tolerability profile make it a suitable choice for many patients.
Weight management medications.
While not primarily indicated for weight loss, topiramate has demonstrated modest weight reduction effects, potentially offering an alternative or adjunctive option to traditional weight loss medications like orlistat or liraglutide. It is important to note that the choice of medication should be based on individual patient factors, comorbidities, and the potential for drug interactions, as well as the risk-benefit analysis conducted by a healthcare professional.
Topiramate for weight loss.
While not initially approved for weight management, topiramate has gained attention for its potential to promote weight loss. Several clinical studies have demonstrated modest but significant reductions in body weight and body mass index (BMI) with topiramate treatment. The exact mechanisms by which topiramate contributes to weight loss are not fully understood, but it is believed to involve multiple pathways. Appetite suppression. Topiramate may reduce appetite and increase feelings of satiety, leading to decreased caloric intake.
Increased energy expenditure.
Some research suggests that topiramate may increase energy expenditure, potentially contributing to weight loss.
Improved glycemic control.
Topiramate has been shown to improve insulin sensitivity and glucose metabolism, which can indirectly impact weight management.
Modulation of neurotransmitters.
Topiramate's effects on neurotransmitters like GABA and glutamate may influence appetite and eating behaviors. While promising, it is essential to note that topiramate should not be considered a primary weight loss medication and should be used in conjunction with a comprehensive weight management program that includes lifestyle modifications, such as a balanced diet and regular physical activity. Topiramate for migraines and epilepsy. Topiramate's efficacy in the treatment of migraines and epilepsy has been well established through numerous clinical trials and real-world experience.
Migraine prophylaxis.
Topiramate has demonstrated significant reductions in the frequency, severity, and duration of migraine attacks, making it a valuable preventive option for individuals with chronic migraines. Its mechanism of action, which involves modulation of glutamate and GABA neurotransmission, is believed to play a role in its anti-migraine effects.
Epilepsy management.
As an adjunctive therapy for partial-onset seizures, primary generalized tonic-clonic seizures, and seizures associated with Lennox-Gastaut syndrome, Topiramate has proven to be an effective treatment option. Its ability to modulate voltage-gated sodium channels and enhance GABA-mediated inhibition contributes to its anti-epileptic activity. In addition to its primary indications, Topiramate has also shown promise in the management of other neurological conditions, such as neuropathic pain and cluster headaches, further expanding its potential therapeutic applications.
Conclusion. Is Topiramate the right medication for you?
Topiramate is a versatile medication that has proven its efficacy in various neurological and psychiatric conditions, including epilepsy, migraine prophylaxis, and binge eating disorder. Its unique mechanism of action, broad-spectrum efficacy, and potential for weight loss make it an attractive therapeutic option. However, it is crucial to carefully consider the potential side effects, precautions, and hazards associated with Topiramate.
Close monitoring and open communication with your healthcare provider are essential to ensure safe and effective use.
Ultimately, the decision to initiate Topiramate therapy should be based on a comprehensive evaluation of your individual medical history, current condition, and potential risks and benefits. Your healthcare provider is best equipped to determine if Topiramate is the right medication for your specific needs. Remember, medication adherence and lifestyle modifications, such as a balanced diet and regular exercise, play a crucial role in achieving optimal therapeutic outcomes. By working closely with your healthcare team and following their guidance, you can maximize the benefits of Topiramate while minimizing potential risks. If you or a loved one are considering Topiramate as a treatment option, we encourage you to schedule a consultation with one of our highly qualified healthcare professionals. Our team of experts is dedicated to providing personalized care and guidance, ensuring that you receive the most appropriate and effective treatment plan tailored to your unique needs.